So good afternoon, everyone, and welcome to the third annual Fortune Brainstorm Health. Our theme this year is, oops, we have a missing mic here. We have a jam-packed, our theme this year is the Fortune Leadership Summit, reframing the health agenda. And you guys are not, that's not an accident. You're all here for a reason. Each one of you is a leader in healthcare. And over the next couple of days, we will explore and reframe the agenda. We have a jam-packed couple of days of incredible discussions and on our way through the closing interview, so I hope you all stay for Kevin Durant, the four-time NBA scoring champion and star of the Golden State Warriors, and we all are very excited for an incredible conversation. Tonight, of course, we have Tony Robbins, which is going to be an amazing conversation as well. And with that, I'd now like to introduce my two co-chairs, the dream team of Fortune Brainstorm Health, the incredible Dr. Agus, who has been my partner in bringing Brainstorm Health to life from the very beginning. He's a physician and New York Times bestselling author of 3 books, CBS News contributor, the recipient of numerous honors and awards. He's a professor of medicine and engineering at USC, as well as the founding director and CEO of the Lawrence J. Ellison Institute for Transformative Medicine. And we are so fortunate to have his expertise and guidance on the team at Brainstorm Health. Last year, we were delighted to announce that Arianna Huffington would be joining us as a Brainstorm Health co-chair. And this is Dave and me proposing to Arianna, as you can see. And you all know Arianna as the woman who put the front page on the internet. As the co-founder and longtime editor-in-chief of the Huffington Post, she's written 15 books, 7 of them raging bestsellers, and her new company, Thrive Global, is intent on starting yet another revolution. This time bringing wellness in the workplace and showing real benefits for both employees and a company's bottom line. And I can't tell you how fortunate we are to have her insights and passion taking Fortune Brainstorm Health to the next level. Now, please welcome Dr. David Agus and Arianna Huffington to the stage for an overview of where we stand at. We're doing the slow handshake here. Hey, please sit. Okay, we want to frame the agenda for the next couple of days, and we thought, you know, we can't just dive in, right? So we have to have some big picture sentiment to get us started. And I wanted to talk about
What's wrong with diving in?
Well, I guess we could dive in. We tried that last year. So I wanted to start with data, which is the cover of our Fortune magazine, this big data revolution, which I hope you've all seen lying around. It's really the centerpiece of what's happening in health and technology now, and this ability now to harness that data and to make sense of it is important. And then Arianna said, you know, the theme of this is the Leadership Summit, and we really ought to talk about what it means to be a leader in this space.
Because this is an amazing inflection moment. And by having all these amazing people, amazing leaders here, we can actually not just reframe the healthcare agenda, but build a community where we can keep working and talking and getting things done after the conference ends tomorrow. And as you know, for me, what's exciting is that now big data can empower each individual to take charge of their healthcare, but also to recognize that big data alone does not drive behavior change. And that's why during these 2 days, we're going to also address the big picture questions, including death. You know, death as a way
We're going to answer that last, though. The death comes at the end.
All right. Death, you know, just to show
right.
how a perspective on death helps us live our lives in a healthier way. We are going to have Kevin Durant speak about how he uses his sleep, recovery time to improve his performance and walk us through his stats. So new role models, big picture questions, an emotional connection are all leading towards behavior change, and big data help us get there.
Dave, can big data cure a rib fracture?
No.
Okay.
You know, it's an amazing thing if you look at the people in the room. And I think one of the things that I've learned from doing this with you for 3 years is that there's no one company that will win. I mean, one of the things is we all have to work together. And so there's a continuum in healthcare. And whether it be the last mile, the middle mile, the first mile, we all have to work together. So the hope is in these 3 days, each of you start to meet collaborators. Deals come out of the hallways, deals come out of the talks here, and that together we can make a difference. And one of the problems in health, as Arianna alluded to, has been engagement.
Yeah.
Right? How do you can build the greatest product in the world, but if you can't build repeat user among the consumer, it ain't gonna work. And how do you get them to see the metrics that are gonna get them improved? And so I'm excited to get the collaborations and the talks happening to try to make some progress.
And we're going to see the evidence of the fact that the balance of power is changing. As you said, the balance of power is really going more towards the patient, who's the center of this data universe. And she hopefully will be able to look at all of this data that's coming out of her life and make sense of that in a way that will allow her to take that next big step that benefits her.
And ideally, what we want to discuss over these 2 days is how can we put not the patient in charge, but the individual before they become patient.
Right.
We want to go upstream. We want to address stress triggers before they become symptoms. We want to look at how can we change our lives and our choices so that we can prevent a lot of the diseases that we're now dealing with, because as you all know, 75% of healthcare problems and healthcare costs are preventable and stress related. So this is kind of this amazing moment when we have all this power, but also we need to look at some of all the wisdom to complement the big data.
Right, so all the technology in the world isn't going to change your outcomes if you're still smoking and you're still sitting on a couch all day and you're not getting enough sleep.
Well, I mean, hopefully it's deeper than that. And hopefully, the big data revolution is going to start to identify things all of us can do. I mean, because the key is the prevention, right? I mean, put me out of business. I mean, I'm a cancer doctor and I don't want to see patients anymore. And more than half of cancers are preventable, yet we're not doing it. And I think much of the responsibility is going to fall toward the corporation. And that's what we keep forgetting, is that corporate change, to get normative behavior change, you need leadership, and corporations are providing the leadership in health in today's world.
So we actually started this conference with an eye towards the idea that business, the big business, was going to be the driver in this. That business was the vehicle for social change in a lot of areas, but particularly in healthcare, because they were footing much of the bill for this stuff. And you, Arianna, you've created a whole new enterprise based on trying to get businesses to think differently about their own healthcare costs.
Well, because what we are finding at Thrive with all our different corporate clients is that they are recognizing the connection between taking care of the well-being of their employees and the bottom line. These are no longer soft, fluffy issues for HR. These are actually now touching the CFO department because they affect attrition, they affect productivity, they affect engagement, they affect healthcare costs. And that's what has changed.
And so that's why we see JP Morgan, Chase, Amazon, and Berkshire Hathaway moving to form a partnership, because this is something that fundamentally affects their bottom line for a long time to come. It's why we see all of these new mergers and partnerships, as we've written about in the magazine, but obviously CVS Aetna and Express Scripts Cigna, and all of these things are moving because this is so fundamental to their business into the future.
Well, I mean, obviously, we've become a mature industry. Warren Buffett's interested in what we do. That's pretty cool.
Yeah. I'm not so sure he's interested in what you do. But I'll buy that. We'll just let that one pass for a while.
But also, as we've discussed many times, in fact, one of the best things about preparing for this has been all the breakfasts and meetings and calls that we've had. I'm going to miss them. We have to start working for the next one right away. But during all those times, we looked at how human beings change behavior.
Yeah.
Big data is one component because it gives us power over information, but then stories. Human beings change through a combination of data and storytelling, a new narrative about their lives. And bringing all that together in our different panels today, I hope will lead to the kind of collaboration that David alluded to, which we think is the only way to really change outcomes.
So the technology that can integrate this kind of storytelling and the big data analytics and have it be accessible to everyone on smartphones, with storage of our data in the cloud and instantly accessible. This is a future paradigm that we're all working for. You mentioned the fun that we've had with our meetings and our late night dinners and breakfasts and whatnot. I want that idea of community to really spread out here. We started this 3 years ago with the idea and the express mission that we would form a community. I just saw Sue Desmond-Hellman, one of my personal heroes, and she asked me, what do you hope to accomplish from this gathering? And the first thing that came to mind was this idea of community, of building a group of people who come from very different walks of life, very different sides of the healthcare continuum, as Dave said, and working together to form a new paradigm.
And also, we want to encourage you all as much as possible to put your phones away during the sessions. In fact, we have provided little phone beds outside. I don't know if you've seen them. There are charging stations. You can
So our phones can sleep together?
Yes, your phones can sleep together. That will be the beginning of collaboration. This is a little product that Thrive Global launched. If anybody wants them, you can take them home at the end of the 2 days. You can put your phones under a little blankie, tuck them in, and while you are concentrating on all these important conversations, your phones can be fully recharged when you go back. So it's one of the things we're going to be discussing, our growing addiction to technology and our phones, and what can we do about it.
So whenever we begin one of these kind of conversations, it always gets a little pie in the sky. We all talk about the power of technology, the power of behavior change, the power of the consumer, everything in our pocket. What is the reality check? Take me to the dark side, Dave. I count on you to always do that. At the end of this, what are the barriers that are going to actually stand in the way? What is the one thing we're going to say that this is not what consumers are going to be able to do?
There have been dozens of startups in healthcare, as we've all seen over the last decade, and almost none of them have worked in the grand scale, because adoption at a consumer level is difficult. Right. It's so hard to get you to think about something today that's going to affect you in 10 or 20 years.
Right.
How do we get behavior change to happen with a time lag for disease? It's very difficult. At the same time, how do you make a business model of it? The business of health is treating disease. We want to change that so the business of health is health.
Yeah.
And that's going to be a radical change to the system, but it has to happen and it will happen.
But the reason I'm optimistic is that the conversation has changed. Mm-hmm. First of all, this conversation about health and wellness in the workplace has gone from the health magazines to Fortune, to the Wall Street Journal, to ESPN.
Right.
It's really become part of the mainstream, and that's very significant. And also, you can have your Apple Watch tell you your heart rate variability and tell you your blood pressure. So you have a lot of data coming at you, which then you can actualize to bring about changes, which, as David said, are not easy. But at least a lot of good things are happening to make them more likely.
We've had a reductionist view of the world historically, right? You take this to lower this, or you take this to correct this number. And what we're seeing is that we're a complex system. The paper came out today in Nature. It is the freaking wildest paper ever. 25% of the drugs on the market today that are non-antibiotics affect our microbiome. 25% of drugs affect our microbiome. So all of a sudden, here's a new complexity that a blood pressure medicine may affect your microbiome, which will affect what foods you absorb and your lipid levels or your sugar levels. So all of a sudden, there's a complexity. The only way around that is these large data and outcome studies, which many of you and your companies are doing. So it's a staggering time, and we never had this power till today, but it's here.
And do you see a time when consumers really will take charge in the way they do in other parts? If I go and rent a car, I really want to make sure that I get the car I want when I want it, and if not, I'm never going back there. Do you think do
People don't rent cars anymore.
They don't rent cars. No, that's true. This is a totally different world.
Uber.
That's right. But do you see a time when we are going to have consumers feel just as empowered and have the access to the information they need to make decisions? Because a lot of times we don't pay for those decisions in healthcare. How do we change that?
When you checked in today, you got a piece of paper that gave you a free BRCA or breast cancer susceptibility test with color genomics.
Yeah.
So all of a sudden, right, the consumer can do this themselves and know whether they're going to have a disease, breast cancer or ovarian cancer, that's somewhat deterministic.
Right.
That's a shift in power. And I believe in the responsibility of the individual, and I think we have to go there.
Fantastic. All right, so you have an exciting moment over the next 2 days to talk about all of these issues, and I hope you'll all let us know where we come out at the end. Please let us know what you love and what you don't, and we'll have plenty of time for questions. Thank you very much. Now we'd like to recognize our exceptional partners who have made this event possible. And I mean that, profoundly. Our founding partner, IBM Watson Health, who really, from the very beginning, believed in this message and has encouraged us and pushed us and made it as expansive as they can. Our gold partners, Abbott and Herman Miller, and our silver partners, City of Hope and Parexel.